So now we're into the third part of this chapter, and this is really just fairly brief, in part because what I'd like you to do to start with is watch a movie. And it's a full-length feature film. It's about 2 hours long. The movie is called Boys Don't Cry. Now, even if you have already seen the movie, I'm going to ask you to watch it again, simply because if you've seen it in the past, you probably were not seeing it through the lens of somebody who is now learning about gender dysphoria in an advanced abnormal psychology class. So please indulge me, take 2 hours, kick back, make some popcorn. The movie is streaming off the library website from Criterion On Demand again. So if the link does not work, you need to go to the MRU library website, search for Boys Don't Cry. It's available and streaming on the Criterion On Demand service. You do need to be logged in using your MRU credentials. The library also has a physical copy on DVD if you want to go old school, but just remember that you can pick it up to borrow it, but you have to request it and then make arrangements for curbside pickup. When you're done watching the movie, come back to this lecture for reflection questions number 1 and 2. Which character in the movie did you find most despicable? That's question 1. And question 2 is, do you think other issues, so substance use, petty crime, poverty, in Brandon's life were impacted by him being transgender? Why or why not? Okay, so this lecture, there's going to be quite a few links that I send you to, which I think is okay, but you might disagree, but that's okay. So let's talk a little bit about what gender dysphoria is and what it isn't. Gender dysphoria is essentially gender incongruence. The biological sex does not match the gender of the individual. So the person does not identify as the gender they were assigned at birth. Their bits don't match how they see themselves. Okay? The diagnosis is made by a mental health professional. And I think it's really important to understand why gender dysphoria continues to be in the DSM. So first of all, DSM-5 made a name change. Prior to DSM-5, gender dysphoria was called gender identity disorder. There is a large recognition in the psychiatric and psychological community that gender dysphoria is not a mental disorder. Okay? We do not want to force people to remain the biological sex they were assigned at birth. We do not want to force people to conform to what society expects of them. We don't think they're mentally ill. So the name was changed to gender dysphoria to capture this gender incongruence, to capture that a person is not happy with their physical body, with the gender they have been assigned at birth, because that's not how they perceive themselves. Gender dysphoria exists in the DSM largely because people who experience gender dysphoria need to have access to psychologists. While we are working on becoming a more inclusive and more tolerant society, we're not really fully there yet. People who identify as transgender meet violent deaths simply because they're transgender, for no other reason. That's a problem. People who identify as transgender are often alienated from friends and family. Some have been known to lose their job, lose friends, lose access to their children. You need access to a psychologist because you're not navigating the same world as people who do not experience gender dysphoria. There often can be depression, anxiety, self-harm behavior, drug and alcohol use, eating disorders that are comorbid with gender dysphoria. And so we need people to be able to access mental health care, and particularly in the US, we need a diagnostic code for that to happen. And again, remember, the DSM is published by the American Psychiatric Association. So we need this in there for people to have access to treatment. The other piece is that if somebody does want to pursue gender reassignment surgery, so surgery that will alter their physical body so that it matches their perception of self, they will need to undergo regular psychological visits for at least a year prior to that surgery, because a psychologist needs to sign off. Not that a psychologist has to sign off on saying and guarantee this will make you happy, but the psychologist has to evaluate to make sure that the person undergoing the surgery understands what's going to happen, understands what will and won't change, that the person has a support network and is able to have people provide some of the care that they will need after the fact, to help navigate how to change who they are and how people see them. So typically before gender reassignment surgery, a person has to live as their preferred gender for 2 years. And that's 2 years prior to surgery. So that's tricky, because that is oftentimes when people are ridiculed because it's clear that they have not transitioned yet. It's also when people will start some of the other procedures. So they'll start hormone therapy. They may start to have cosmetic procedures to help shift their appearance, but they won't actually have the reconstruction for at least 2 years, okay? So that's just really important to keep in mind. All right, what did I say? Well, I just want to take a quick look here at what else I have here. So psychologists do not consider gender dysphoria to be anything other than a natural expression of self. Our job is to support people where they are. So if somebody wants to transition, it's our job to support them. If somebody doesn't want to transition, if somebody wants to change the way they perceive themselves, and they say, like, I know, so again, I'll just use myself as an example. So I'm sitting here, I have a female body, I look like I'm female, but in my head, I see myself as male. And if I go to a psychologist and say, I want to see myself as female, then we would expect the psychologist to work with the person to do that. But it's not up to the psychologist to say to me, you know, I look in the mirror and I see a female, but in my head I should be male. A psychologist should not be saying to me, well, then we have to help you see yourself as female, right? That's my choice as an individual. Do I want to live with the gender I was assigned at birth, or do I want to live as the person I'm meant to be? My choice, not the psychologist's. Psychologist's job is to support clients where they are on this, not to push one way or the other, according to their own worldview. Okay. Calgary recently banned the practice of conversion therapy. Conversion therapy, of course, is when we try to convince people to align themselves with their biological sex. That has now been banned in Calgary. I think it has been in Edmonton too. It's banned in quite a few jurisdictions because it doesn't work for the most part. But if somebody wants it, right, then we have to send them elsewhere and also try to find out why they want it. Largely, the treatment for gender dysphoria is cosmetic, endocrinological, and surgical. Okay, so cosmetic includes things like hair removal, modifying hairstyles and dress to match the identified gender. Endocrinological is going to be the administration of hormones. So in prepubescent children, they may be given hormone blockers. Hormone blockers do not change them. What it does is it stops them from going through puberty. So it stops the changes that would happen. So if you have, let's say, a 9-year-old girl who identifies as a boy, she could go on to, or he, sorry, could go on to hormone blockers that would prevent him from going through female puberty, which would make the process of transitioning as an adult significantly easier. But it's not, children generally, younger children are not given the hormones of the opposite gender, but they will be given puberty blockers. And then post-puberty, you would be given the hormones of the opposite gender. So women would be, trans men would be given testosterone, trans women would be given estrogen. Okay, and then the surgical component is going to be gender reassignment surgery. People will not always have that. People will also sometimes have partial. So they talk about it as both top and bottom surgery. So for a trans man, he may opt to have breasts removed, to have top surgery, but may opt not to do anything with bottom surgery. Okay, or no surgery at all. Again, we have to work with people where they are and let them make these decisions. Now, I've got a couple of videos and a couple of articles for you to read. The first video is about 5 minutes. It's great, it's powerful, but it's not like what I had you watch last week. And then there's an article about the father and the daughter in this video, because they both came out as transgender. Then there's another brief YouTube video, 6 minutes. And then there's an article on Blackboard that I think would be really interesting for discussion. It's transgender men who experience pregnancy after female to male gender transitioning. So I just think that would be something interesting to talk about. So I'm going to ask you to do that. And then reflection question number 3 is, do you think people should be a certain minimum age before living as a member of the opposite gender or their true self? Why or why not? And if so, at what age? And that's that.